Kathryn Morgan is going to be talking during this session. She's in her 4th year and a full-time student at Brescia University College, an affiliate campus to the University of Western Ontario. She is currently working towards a degree in nutrition and dietetics and plans to pursue a master's in international health. Kathryn is currently involved with the Western Heads East project as the past chair of the Fundraising and Education Committee. This is a student-led committee that works to raise awareness about HIV/AIDS epidemic in East Africa and raise money for the project. Kathryn was also an intern in the summer of 2010 in Mwanza, Tanzania, under the supervision of Dr. Share Hekmat, doing research with the problematic yogurt and quality control in the kitchen. She was also involved in expansion of Yogurt Kitchen to other sites around Mwanza region. Kathryn also holds a position as president for the Canadian Association of Food Service Professionals Student Branch, which is a club at Brescia University College. This association helps facilitate the professional development of students and hosts educational events about the food industry. So if I could get you all to welcome Kathryn.
Hi everyone. I have a little bit less experience than probably Professor Sachs has, but I have been involved in this project since my first year of undergrad, so I know a lot about it. And our coordinator at Western, he's actually in Tanzania right now doing some groundwork, just meeting with the key stakeholders, keeping those relations, the rapport there. So he's there with a couple of other professors from the school as well. So he's asked me to step in. So I'm hoping I can do the program justice and give you guys an interesting perspective and a neat, smart solution that UWO came up with to address the HIV/AIDS epidemic in East Africa. So I'm just going to start with a small video. It's from the mamas that actually work at the kitchen in Kenya. So it'll give you a good background on the project. And it's just nice to see it coming from the mamas that are working there.
My name is Peter Mwana.
Florence Atieno. My name is Bill Darwin. I am a social worker as well as a researcher. Currently, I am working with the National Health Equity as well as Kasipul Division HIV Positive Clients Network, which I am the secretary.
I work with Kakilo Integrated Support Project. I work as a volunteer and also a community worker.
I work with CCC as a volunteer. I'm interested in working here because I'm a person living with HIV. I work here as a volunteer. I am a person living with HIV/AIDS, having tested positive in 2004. I am also a widow. My husband passed away in 1998 December. But up to date, I've been living with the support of ARVs, which I started taking on in 2006. So following the poverty levels here on the ground, especially in the which stands at 77%, is so high, and most people are defaulting from taking the antiretroviral drugs because they don't have food to eat. Taking the drugs without food has some effects on us, and at times when we take them in an empty stomach, the stomach rumbles and we get a lot of pain here and there. So it even makes us feel more sick. So instead of feeling sick because of the drug, we always opt for not taking the drugs, which is just as risky as not taking it.
The yoga program was brought to us through Isabel Rachmana, and I'm now taking it. This day is my 5th day since I started to take it. I'm now feeling strong.
The yogurt. We are told that the bacteria inside the yogurt is good for somebody living with HIV, in that it can actually boost the immunity system.
Sometimes I'm in the salon. When times hit for me for yogurt, I Are you ready for it?
I do think that the project will really help the people in the different AIDS. Me personally, I'm really positive and I'm on part. I thank the yoga team for bringing the project to our health facility. And we would like the project to go to other places and help to work with the yoga team.
With the program that has been introduced, the yogurt program, we are very happy, and in fact, I'm privileged to be in this first group of people who are taking the yogurt, because for me it is a supplement. I take it to be a food supplement, because when I don't have food that I've taken, the yogurt, I feel it is okay for me, because in most circumstances, it is so hard to get 2 meals a day as normal in the society. But if I visit, the yogurt is there to supplement.
I'm proud of the yogurt. I really like it.
I believe that if it continues, many more will come to get the benefits of the yogurt, and at least I believe by the time I will stop taking it after 6 months, I see people shall have risen. When I started, it was 334. I believe it will rise. I believe, because I come daily, I hope this. I hope my colleagues are also doing the same.
Some are telling me that after taking the yogurt, they feel good. They feel good. So it means yogurt will do something. It will do something to those who are living positive.
Since I started taking it, I'm feeling strong and I'm happy.
Okay, so that was just a kind of quick introduction to the project. Sorry. Okay, so Karibuni, which means welcome. In Tanzania, everyone always says welcome whenever you come over. I felt very welcomed in that culture. My name is Kathryn. I'm a 4th-year student at Brescia, like I was introduced by Adam, and I've been involved in the project since my first year at Brescia. So my goal for this presentation is just to really introduce you to the project, but also to get you guys to really think critically and to, when you're looking at a project, you want to go volunteer, how to evaluate what the project's all about, and to think critical about, are they accountable? Are they, I like to use the word collaboration. I think this project's a really good example of how you can collaborate with people instead of just going in and thinking you know what's best. Because what I found out is you have to lose any sense of ego. You can't have any ego when you go to volunteer internationally, because what you think to be true is completely different in a different culture. You can't really come in thinking, no matter how much you've studied, when you go into that culture, there's going to be differences and you're going to just have to adapt. And like this picture, I just was thrown into this dance. I had I went up there, I went to this Sakuma Tribe festival, and they asked me if I wanted to learn a dance. I said, sure. And they threw me right in, and I had to just follow along, and I was in front of, hundreds of people, and I hadn't had any experience, but what I learned is you just have to jump in sometimes and just go with the flow and adapt along the way. Okay, so the Western Heads East Project, does everyone know who Stephen Lewis is? Yeah. Okay, so in 2002, he came to Western to talk about the HIV/AIDS epidemic in Africa. So 2.3 million Africans were dying every year, and this really struck a chord with the Western community, and they wanted to rally together to figure out a solution that would be effective and sustainable. So the response was a yogurt kitchen. So you might be thinking, okay, so where'd that idea come from? At that time, there was actually a lot of research being done at Western through Dr. Gregor Reed. He was developing a probiotic strain that was actually being looked at being added to yogurt, which is where Dr. Sherry Hakamat, who I had as my supervisor, they kind of collaborated. They're developing this product. They're developing this product. And so this was in the media at Western, and a group of housing faculty and staff and students all got together and they saw that, and they wanted to make a collaboration with these women's groups in East Africa and help them to learn how to develop a business around yogurt production. So it was a really unique solution. I mean, it's more than just the health benefits. It was about creating a business opportunity for these women. This would help them to become more independent financially and ultimately reduce violence against women, which is very common around the world, but it's especially in Africa as well. So if they have their own income, they're not as dependent on their husbands, on their fathers. They can have a little more bargaining power. That inequality between men and women isn't as great, and so that can help to contribute to reducing violence against women. And I know that's kind of big picture, and you think, okay, it's a yogurt kitchen, but you know, more and more women are getting involved in these kind of small micro businesses, and this is what we wanted to do, was to allow them this economic vitality. So this project doesn't only increase the health of the community, it also increases the economy of these women that are involved. So like I said, it's simple. Like, it wasn't like huge technology involved. It's really easy to make yogurt if anyone's ever done it. I had to learn how to make the yogurt. There's a few steps involved. You have to make sure that the yogurt gets up to a certain temperature, so there's quality control. There's a few different things. It is a business, and so that's why we've collaborated with a bunch of students across campus. So people from all different backgrounds can get involved in this project as well. I'm in foods and nutrition, but there's been a lot of IB and business students. There's been people in anthropology, health sciences, anything really that you're in school for can relate. There's always a connection that can be made. So that was really neat. There was that interdisciplinary aspect of this project as well. And so, you know, it was just, it really affected the community on so many levels. It was at the individual level. So it was influencing these women at the individual level, also the community and political, because they needed to get their buy-in. As you'll know if you've done any international work, you really need a champion. You need someone who's going to work with you and tell you what, from their perspective, needs to be done. We had this idea, but if it didn't fit with the culture, it was never going to work. So we really had to get the key stakeholders involved. We had Kivulini's Women's Rights Organization. Maimuna Kenya Mala is an amazing woman. She founded that organization, and she is the one that actually helped us to get the first kitchen off the ground. She went out and looked for women that she knew would make the project successful. So she pulled together all these women from different women's groups and created the Tukamwane Women's Group. And that was the first kitchen, which was set up in Mwanza, Tanzania. Does anyone know where Mwanza is? Yeah, okay. Who's heard of the project, actually? A few of you? Okay. Okay, so the Tukamwane Women's Group opened in Mwanza in 2005. And so again, talking about collaboration, that's a key word I always throw out there, because what we know, you know, maybe doesn't translate into what will work there. So having those key stakeholders involved, they can tell you what needs to be done. Yeah, it's great if you have a good idea, but will it work? Will it translate into something that will be effective? So we had partnerships with NIMRI, which is the National Institute for Medical Research, because the project was, a lot of the funding came through research, right? So we had them on board. They also were the ones that were going to be actually culturing the probiotics. So does anyone know, what's probiotics really good for? Does anyone? Yeah.
Digestion and
So as she said in the video, her CD4 count, which is just a kind of a biomarker of her immunology, her immune system, it can actually help to boost the immune system. One of the common side effects of HIV/AIDS and also taking your antiretroviral drugs is the diarrhea. and that can cause a lot of nutrient malabsorption. So people who already are malnourished, it's just going to be exacerbated. So the yogurt also acted as a food supplement, like they said in the video, and so that was really important. The probiotics was really important in that sense. So obviously we needed someone in the medical area to be able to culture the probiotics there, because we weren't going to be able to, fly them over to Tanzania every time we needed them. So we developed, we brought the first strain over, but then we actually worked with the medical institute to be able to have the skills to continue to produce it. And so the mamas will come every week to the building to pick up their probiotics, and that's added to the yogurt when they're producing it. We also had local government officials involved. So again, the key stakeholders that know the community and know it well, know what's going on in the community and what their strengths are. Because it's really important not to just look at, what did they need, also what their capacities are, and building on that. Women's groups are amazing. It's everywhere. There's so many small women's groups that act as small businesses. So we tapped into that already built-in capacity. There's these women that are very smart, they're motivated, and just bringing them together around this project was really important. So in Canada, we have a steering committee that kind of oversees the broad goals of the project, but we also have a steering committee in the locations where the kitchens are, because again, we need the perspective of the local people. And so that was really a big aspect, is that we're not just doing work here, we're having work done there, and there's that collaboration going on. Communication is really key. And as well, along with this project, it's about the interns that go to do the work with the women's groups, but it's also about the fundraising and education committee here. So that's kind of twofold. So I was the chair of the fundraising and education committee last year, and it's a small group, but its aim is to raise awareness about HIV/AIDS, both locally and globally. I think it's really important to make those connections with what you're doing overseas to what you're doing at home, because HIV is a problem here. It's not a problem in the same sense that it is in East Africa, obviously, but there are people living with HIV/AIDS in London, and there's stigmatization around HIV/AIDS still here as well as over there. So some of the issues are transferable, and just raising awareness of how one can actually get HIV is really important. I know when I was going over there, people were like, oh, aren't you afraid you're going to get HIV? And obviously, if you're, there's just certain situations that you can get it, and you can't just get it from casual contact. And I think there's a lot of misperceptions around it. And so that's one of the things that, even when we were over there, the probiotic yogurt was being subsidized for people living with HIV/AIDS. So there was a misconception that this was just for people with AIDS. So some people didn't want to go there because they thought they would be stigmatized by the community. So we had to work on marketing ourselves as being beneficial for everyone, because probiotics, yes, they're good for people with HIV, but they're also good for everyone else. It's just beneficial for anyone. So that was kind of one of the challenges that we had, and I think it's an important thing to acknowledge our challenges as well as what we did well. Going back to accountability, you can't just promote, the happy picture of the kids on everything. You have to look at what you did, what worked, what didn't work, and I think that's where you can actually move forward. If you're being critical about what you're doing and not just accepting it, then you can actually move forward. Okay, so each intern has their own unique skills, their own unique background, and so everyone goes with certain objectives that are related to their field of study. I think that's really important about this project, is it's tailored to the skills you have, because it's good if you want to go volunteer. I think that's important, but it's not enough. You need to have skills, and you need to have something that you're actually going to help them with. So my background in food and nutrition, I did a little bit of the business side, but that's not my background, and that's not where I can really help them. Where I could help them was teaching them about quality assurance with the probiotics and with the actual production of the yogurt. That was my skills, and that's where I could collaborate with them. They probably know how to make yogurt 100 times better than I could ever do, but I have certain skills that I could try to help them with, just, taking temperatures consistently, reinforcing the food safety aspect of it, because it is yogurt, it will go bad. It does stay fairly well, and one of the things was electricity, right? They have fridges, they had electricity, but sometimes the electricity would just be shut off. Though, I was there during the World Cup, so I never saw the electricity go off during a soccer game. So, maybe we need to just have some big event all the time so the electricity stays on. But that was another thing that challenged us. What do you do when your fridges aren't working for a day or 2 days? If the yogurt goes bad, there's other ways to cook the yogurt. They had hot plates, but you could also use different, like just a fire charcoal to actually heat the milk, so you could still produce it without electricity. But the fridges were the bigger issue, and it would just go bad, and maybe that's something that our project needs to focus on, figuring out when the electricity goes off, how are we gonna, maybe we need to just go into the community, get rid of it, give it to people, even if you're not charging for it, because that's, it's better than wasting it, right? So there are different challenges involved with every project. So again, like I said, I did quality assurance. I also worked with a locally grown plant called moringa. Has anyone heard of moringa? Yep, okay. So it's known to be fairly nutritious, and it is locally grown, which is very important. You don't want to be looking outside of what they have. So I did some testing. There was Dutch interns that were working on the project at the time with Dr. Reed. And so I was doing some work in the labs at NIMRI using whatever their materials they had, which, if you have a medical research institute here, they're going to have everything you need. But sometimes, they didn't have a centrifuge for some things. There was just things that you had to go without. So we were trying to test if we could add moringa to the yogurt to produce a new, even healthier product. And what we found was that the milk was curdling. We tried different levels of fat of the milk to see if that would impact it. We tried autoclaving it before adding it to see if there was some bacteria that was causing it to ferment. We had to try a lot of different things. And finally, it was you had to make the yogurt and just add in the moringa. And while it was setting, just stir it in. And that seemed to work okay. But when I came back to Canada, we had to test whether or not the probiotics were viable in that new product. It's viable in the yogurt medium, but we wanted to make sure that the probiotics weren't being killed by the addition of the moringa. So when I came back to Canada, I actually got to work with Dr. Hackmat in the lab, and I, plated all the samples and did a bunch of controls. I did it with moringa, without moringa. I did it in just the MRS broth. I did it in just a milk medium. So there was all these things going on that, yeah, you can develop a new product. Now you have to test it and make sure that the probiotics are still in there, because that was one of the key points of this project, was to deliver probiotics in a medium such as yogurt, which is really good for that. But if you add anything in, does it change that? So there's always things to consider in that. I also sought opportunities to expand the project. Tugamwane was one group in Mwanza, and as anything, you want to try to expand, reach more people, and so I was involved in writing some funding proposals to different organizations, meeting with local officials, and trying to increase the awareness about the product. So yogurt, I don't know if anyone knows much about East Africa, but it is eaten there. It's not probably widely distributed. Probiotics in them, there's no direct translation for probiotic in Swahili. What we ended up using was Vertebishu Nzuri, which is just good bacteria. So there's that barrier as well, because bacteria, that's a negative connotation. People don't want to be eating bacteria. So we had to really do a lot of education around what probiotics are, what good bacteria are, and what is that value added to the product. They could go buy yogurt from their local store, but what's the difference of going to this place and getting yogurt that has probiotics? So you really have to focus on what is the value added. When you think about milk versus water, it's both a liquid, it provides hydration, but what's the added value of drinking milk and not just water? So you kind of have to realign people's perceptions and increase awareness by marketing the product. So the yogurt is actually called fiti, which just means fit, to make it desirable to the community and make it the connotation to be just, it's to build health. Okay, so I kind of already talked about these slides. Again, just keeping those relations with your key stakeholders, keeping the rapport open, because your internship only lasts about 3 to 4 months. So every time a new intern goes, you want to make sure those relations are being maintained. Otherwise, the project falls apart. So that's another key aspect to project work. One of the problems we faced was that the yogurt was really inconsistent. Sometimes I'd go in there and it would just taste phenomenal. Now, it doesn't taste anything like the yogurt you get here. Has anyone ever tried kind of like the Balkan style yogurt? It's got a very unique taste. And even, and I found the taste of the yogurt in Wanza was even different than Balkan. It just had a whole nother, I don't know how to describe it. It was just different. But everyone loved it there, and that's fine. That's what they could sell. They were able to sell it. But the consistency wasn't always, the product wasn't always consistent. So just working with those steps, those critical control points where you can make sure that you're taking your temperatures, making sure that the product comes out the same, because that's important in business here. And I think just that was one of the things you had to transfer that idea to the mamas so that they knew how important it was to have a consistent product that people will know what they're getting every time, and that the probiotics are actually going in the yogurt. We had some weeks where things came up and they just couldn't get to the Medical Research Institute, so they weren't getting the probiotics. So it was yogurt, which is fine, but we wanted to make sure that it was a probiotic yogurt because that's what we were advertising it as. So we had to really kind of reinforce the idea that it is important to go get the probiotics and make sure that that product is consistent. I also was involved in doing a sensory evaluation. So we're always looking at new ways to market the yogurt better. I did it with locally grown purees. So I did actually avocado and banana. Avocados are just phenomenal there. They're like this big, and so they're really cheap. Bananas are everywhere, so that's really cheap. It would be feasible, and so that's kind of why I chose it. I also added inulin, which is a prebiotic. Now, it's not grown, or it's not grown in East Africa, so that would be an issue. So we'd have to probably come up with another type of prebiotic, but for the purposes of my sensory evaluation, it was to see if people actually could taste a difference or if it was acceptable to them. One important thing about research, our project is tied to research, but you have to make sure that you're going back to the community with what your results are. So in my 4th year, I still have to do it next semester is when I'll actually come out with the results. I have to do a paper. But after I do that, I'm going to go back to these women's group and let them know what the results of my research were, because it's unethical not to. It's so important that if you're going to be testing something on them, even if it's harmless, you want to make sure that you are going back and having the information go back to them. This was just my supervised research when I was actually back in Canada. It was easier to do here because we had everything I needed to actually test the viability of the probiotics. I mean, that would be something, if we wanted to do it there, how could you overcome that? it's again, it comes into a question of funding. How do you get funding to do that? You have to make a case that it is important that the research can be done. It would be nice to have been able to do the research in Mwanza while I was there, but it wasn't feasible at the time. So just some other things that I wanted to show you. I went to Arusha. So the interns that were in Arusha, they had a completely different experience. They were starting up a kitchen. I went into a kitchen that was already fully functioning. The mamas probably could tell me more about the business than I ever could help them. So from my experience in Mwanza, I was able to go to the new kitchen and kind of give insights into how things were running at that kitchen. I painted the cow. That was, I don't know. It was a good trip, and it kind of gave me a new perspective on the project, kind of starting it from ground up. Also, the project is in Kenya, Oyuga, so there's 2 kitchens there. We're trying to kind of expand to all East Africa, and there is a lot of interest. I think the awareness there is growing. We've actually recently had a funder who wants to subsidize the cost of the yogurt in Mwanza for now, and then we'll see where it goes, for 2,500 people that are living with HIV/AIDS. So to do that, we actually have to increase the number of kitchens that we have running, because the capacity isn't there yet to actually be able to provide that much yogurt. So we have, I think, about 10 kitchens in Mwanza now. It's kind of really started to grow. It's really grassroots. It was also really Maimuna Kanyamala, she's the director of Kivalini Women's Rights Organization. She's the one that's really gotten it to push to get more women's groups involved. So again, that champion, having a champion who's going to further your cause. Another thing that I think is really important, again, I said you have to lose all ego. I think, showing that you're willing to go into that community and learn their language, learn a lot of the cultural norms, the things like, you don't want to be showing your knees. It's not polite. Shake with your right hand, because when you're going to the washroom, if you don't have toilet paper, which a lot of communities maybe didn't, that you would wipe with your left hand. So that's why it was very rude if you were to ever shake someone's hand if you were to use your left hand. And that's something that you wouldn't know going in. There were so many things that, yeah, you can get trained over here. They can tell you about the culture. You have past interns tell you about the culture. But when you go there, it's just like everything goes out the window. I think it took me about a month to really feel like I was adjusted. And so, going for a couple of weeks, I think it would be a challenge to go for a couple of weeks and be able to make a difference in that couple of weeks when you're doing kind of volunteerism types of things. I think those projects have their place, but for me personally, it took me a month just to feel comfortable and feel like I could actually do something there. So, I don't know. I guess the length of time, we do, like when you go as an intern, you have to do it for 3 to 4 months because they want that level of commitment. They also encourage you to get involved in the fundraising and education team before you go, so you really know the project. I think a lot of times, if you're going with a company, you might not really know all the ins and outs of the projects, and it's so important because what makes our project unique and what makes another project unique, you really have to be involved in the project to really understand the kind of the small details of the project to be able to make it work. So there's some more pictures. So again, the challenges, language barriers. Again, the translation of probiotics, there was no direct translation. We had a coordinator who was from Mwanza. She was great. Her name was Esther, and she helped us with translations when we were meeting with the mamas. We had weekly meetings just to stay up to date on what was going on with them. But you never really get that full insight into what's going on. We found out that within that kitchen there was kind of 2 groups of mamas. There was the morning shift and the afternoon shift, and there was some tensions between them. And we really didn't know that until we really started asking questions about what was going on. Having Esther, who was with the project for a long time, I think that helped us to overcome the continuity barrier, because interns would come and go, and sometimes their messages and what they had done would be transferred over to the next, and sometimes it wasn't. So having someone that coordinated on the ground was really important, and she helped us to figure out some things. Again, expectations. So we volunteer a lot in our society. I think it's just part of our culture. There, it was sometimes difficult because you can't really ask someone to do something for free because they're trying to survive. And they do, though. They will do a lot of things for you. But the steering committee, they really had to buy into the whole concept, because they wouldn't go to a meeting just to go to the meeting if it wasn't worth their time and they didn't believe in the cause. So you really have to create that awareness. Being tired. I don't know if anyone's been on anti-malarial drugs, but it makes you very lethargic, and sometimes it's so hard to get out of bed some days, and you're being exposed to a whole bunch of different bacteria, illnesses, things like that could interrupt the flow of your challenge. Okay. So again, the fundraising and education committee, bringing it back home, I think having the connection between the on-campus stuff we do and the stuff that we do overseas. Okay, so I just have a few questions. What do you guys think is development? What is development to you? Yeah.
Reducing vulnerabilities that people face and providing them with more opportunities.
Mm-hmm. Okay. Anyone else? Yep.
Increasing freedom, substantive freedoms.
Okay. Yeah.
And I think a lot of that is also through something that's sustainable.
Mm-hmm. Okay, so smart solutions, sustainability, I think those are the keywords for the conference. I think sometimes we get into that dichotomy of developed versus developing. I think that can cause a lot of problems in and of itself. I think development, in just the general sense of the ideas that you guys threw out, is really important. We are looking at ways to enhance the capacities of the communities that we're working with, not just telling them what to do. But that dichotomy, that difference, is the one thing that drives inequality. And I think just being aware of that, being there as being a white person, I was a minority, but I wasn't disadvantaged. I think that was really something that my eyes were open to, because, yeah, people that come here, maybe, I don't know, I went there, I was white, I got called Mzungu, which is just a term for foreigner. But I was never disadvantaged because I came from a privileged country. So I think just being aware of your situation, of what it means, those perceptions of what people think about you, I think is really important if you're interested in going abroad. Again, ethnocentrism is the idea that your culture is the best. I think, when we say we're developed, we're successful, we have money, but they're really happy. These people are happy. They're doing what they're doing. They're smart, they're innovative, they're creative, and they're driven. And I think sometimes we think we're the top, but what they're doing, it impresses me. It impressed me so much. The mamas were just wonderful. They're welcoming, and I was impressed by them. So I think, always having that critical eye on what does my presence mean? What does that perception kind of drive? Does it drive inequalities? Does it drive that us versus them, the helper and the helped? Because that's why I think this project was so important, was the collaboration that it drove. And so being culturally sensitive, knowing there are differences, knowing there are similarities, but not assigning a value to it. Being aware and being knowledgeable, these are all different things, but they're all important to kind of take into consideration when you are traveling. I was going to do some of these kind of where do you stand? I don't know how much time we'll have, but I know we talked about aid. I think that's a hot topic in the first lecture. Let's do the first one. International projects reinforce and reproduce social inequalities. What are people's thoughts? Do they agree? Do they disagree? Brave souls. Yep.
I wouldn't say, I would say definitely not reproduce. Reinforce, it depends on how you look at that. It becomes more visible, absolutely, when you do an international project. So you were a minority there, yet you were more privileged. Well, that became more apparent when you were there. But I don't think projects such as that at all would reproduce it or would spread the disease of inequality. I totally disagree with that, because I think the whole point is you're having the development of health, for example, and in turn that will create social equality. I think social equality can be the result.
This isn't like my feelings at all. This is just like just trying to get you to discuss. So like no one should be offended if they agree or disagree with the statement. So aid in the form of money, goods, or food are necessary to help third world countries. I think that was a little bit of a hot topic. What are people's opinions about that? Yep.
I think even Sachs would disagree with that statement, because he was very explicit in saying that just the straight up goods or food or money isn't really helpful. It's introducing tools. For the bed net example, even that isn't just an introduction of bed nets. He was talking about I can't remember the name of the factory in Tanzania. Exactly. But that's introducing a tool where it's produced locally, and you're equipping them versus just giving. And he said, like, he's really big, outspoken against after the Haiti earthquake of giving any money to the government, because where's it gonna go?
Yeah. Yeah. Yeah.
I would agree. I think it's more about aid in the form of systems and giving them the tools to kind of develop things themselves, like working within the community with the goods and the food and things they already have, and creating like efficient systems to develop those in the community.
So building capacities, empowering them to do the work, because we're not always going to be able to go there. I mean, it's cool as an intern to go travel, but I didn't like change their lives. I'm not like, I never thought I would, but I mean, I got to collaborate with them. I got to learn stuff from them. You know, I took away a lot from this experience, and I think going and volunteering is important in that sense. And I think just being kind of critical on the organizations that you are going to go volunteer with. So I'm just going to do kind of my last few words, and then you guys can ask me some questions. So going abroad, volunteering, I think you should do it. I think everyone should be exposed to a different culture. I think our world is so globalized that you have to experience another culture. Just make sure you know the organization you're going with. I knew the project really well going in, and there were still things that I found out while I was there that I was like, oh, okay. But, you know, you work through it, and yeah, I think just knowing the organization is really important. Are you bringing skills that are needed? Are you just going for the sake of volunteering? I mean, you can go do volunteerism, you can go travel. I think it's still great to expose yourself to new cultures. And then go volunteer, but are you actually bringing something that will leave a legacy? So again, is it going to be a positive or negative legacy? Are you going back with the research? Are you bringing skills that will actually sustain themselves? And go for the right reasons. I think a lot of people want to volunteer. Just make sure you have the right reasons for going. Let's see. I think that is pretty much. I think my last big issue is accountability and transparency. I think in this day and age, there's a lot of money out there to be had. I think that not everyone uses the money properly, obviously, and I think there's something to be said for being accountable. So, I mean, I didn't talk about just all the good things that went on when I was there. I think bringing to light the issues and challenges you face. You guys are able to think about it, maybe come up with solutions and tell me so that I can bring it back to the project and improve it. Does anyone know of Elizabeth Pisani? She's one of my favorite people. She wrote the book Wisdom of Whores, and she is an amazing, amazing epidemiologist. If you have a chance, read her book. She talked a lot about projects that work in Africa. You can't export them to Southeast Asia where she was working. It was a wholly different epidemic. The disease was spread by completely different methods, or not methods, different ways. In Africa, it was spread because there's maybe a lot of partners. In Southeast Asia, it was more related to drug use, sex work. So there was a lot of projects that came in and just handed out condoms, handed out pamphlets, and they said, check, check, check. I did that. I said what I was going to do, and I did it. But they didn't check if it actually made a difference. I think that being accountable like you would for a business, you would never just say, oh yeah, I did that stuff. You would actually look if it worked, if you saved someone's life, if you were able to get the message to X number of people for X number of dollars. You would look at those kind of, was it effective, was it efficient? I think that's really important as well. And again, being accountable, always letting people know what you're doing and that it's actually doing what you intended it to do. And I think that's everything. Does anyone have any questions about the project? Yeah.
Okay, so you said that in one area of Tanzania you had a specific donor that was going to give the treatment for 2,500 people. Sorry?
Yeah, and again, it's not treatment. That was another issue.
Well, yeah. But
probiotics, people thought it was to treat HIV or that it would supplement their ARVs, and that was something that had to be worked on through kind of awareness. But that was completely an aside. I just kind of forgot about that, and I think that's important. Sometimes you don't even think about it, and people are going to take it one way.
Okay, so, but the donor wanted 2,500 people to be provided with this, right? And so you said that you had to increase the capacity of the actual city to produce this by creating more of these kitchens, right?
Yeah.
So does the organization have any kind of ideas on how they're going to make that sustainable? Because if the donor funding goes away in, say, 3 or 4 years, then you've got 10 kitchens that don't have customers anymore.
That was my concern. As of right now, I don't know who the person is. It's going to be continuous for as long as the foreseeable future. I think, yeah, again, money can be a problem. Will it be sustainable if for some reason she can't afford to continue? I don't know if that's been thought through. I think right now it'll just be getting as much of the yogurt to as many people as possible, and I think that it's great that someone wants to fund that. If it ever does stop, I think they're going to be faced with a huge issue. I think that they're going to have to sit down and think about what they can do, because you can't just give it to someone and then take it away. I think that would be unethical as well. So I agree with that. I don't really know what their solution to that is. I think right now what they're thinking is that this funder is going to be providing it for a long time. Another issue that came up with this project was when it was in its early stages, Danone wanted to get involved and they wanted to help mass produce it. So there was a dilemma there because you could reach a lot of people, but the yogurt was only half of the project. It was about the women's business, and so they decided to keep it small. What do you guys think? What would you guys do in that situation? Yep.
I think the local businesses are really important because it goes back to the idea of having a support system. If we just go there and give them the goods that they need, it's creating bridging that gap even more, right? I mean, we're creating the inequality without intending to, I guess. But like everyone else said, if we create that support system, maybe it's a small initiative, but eventually it might grow and get bigger.
Yeah. So yeah.
Yeah, and efficiency, I was actually just reading on the bus here about efficiency in small businesses and such, and sometimes the efficiency isn't as important as the jobs it provides, the meaningful work, the community through that, and the ownership of it.
Yeah.
Also, by employing the local business, it increases the education on what the cause is, because the local business is making it, they know what they're making, why they're making it, and it helps teach the locals what it is about.
Yeah, I definitely agree with that. Yep.
Say instead of mass producing just one time, it would be better to replicate it in like different areas, so that it creates quality and all that.
And I think that's what they're trying to aim for. There's been a lot of research through the Ivy School of Business on how do we actually almost franchise it, I think they're looking at, and replicate it in all these different kitchens. But also, they have to tailor it to those unique communities. Mwanza is different than Oyugis in Kenya. Kenya and Tanzania have completely, there are similarities, but they have very different cultures. So how do you replicate it, but also be sensitive to the needs of those communities? I think my big issue with mass production is that if you were to employ, say, some people to go on the production line, they're only seeing one small part of the production. I think there's something to be said for being able to see the whole production of the yogurt. You have pride, you know the product, you are a part of something bigger than just that one specific, you know, adding something in or just being in the factory line. I think actually having, because it's about knowledge, empowerment, and being able to see things from start to finish. I think there is something really, really cool about being able to be part of the whole thing. You feel more part of a community, and you're not just kind of hidden in the mass production. Does anyone else have any questions? We have about 5 minutes left. Yep.
Yeah, we know that the reality of yogurt, they go back quickly. So I was thinking, you know, you said that, you know, they have erratic power supply there. So how have you guys been able to get around, that problem?
The power supply?
Yeah.
I think it's still an issue, to be honest. For the most part, the fridges work. When they do go out, you know, just keeping the door shut and trying to keep the cold in as long as possible, and then the power should hopefully come back on. But yeah, I mean, that's just something that's
they're very sure they use generators.
Generators. Okay. Yeah, I don't know. In Mwanza, I don't think they had a generator. Probably not. Yeah, it's Mwanza is fairly rural. But I mean, it is a city. Like it's I think it's the second largest in Tanzania. It's just very spread out. And there is a small city center, and then it's very rural when you go outside of the city. Yeah.
What about using clay pots?
Clay pots? Yeah.
They use it a lot in Pakistan.
Okay.
Where electricity is, like, it goes out quite quickly, and normally they store it in cool room or between ice, like layers of ices.
Okay.
And the yogurt is basically layered in those clay pots.
Okay, that's a neat solution.
Yeah, but I was thinking maybe climatic conditions in Pakistan and Tanzania might be different.
Yeah.
You know?
Yeah, I mean, again, you'd have to go back to the community and say, is this going to work here? I think theoretically a lot of things work. Sometimes when you go to do them, it's just nothing works. And sometimes something works and you just got to build on what does work. But I actually encourage all of you guys, I can give you my email if you guys have any ideas or any suggestions about things that you thought maybe could work. I think that would be a really cool way to collaborate and find solutions that are smart solutions that will make this project even better. I think it's a really cool project, but I think, like anything, you can always improve it and make it more successful. Yeah.
I'm sorry, I don't know if you mentioned this or not, but what are like the specific nutritious advantages of adding the moringa to the yogurt? I don't know the specific nutrients that are involved. I think there's like vitamin A and vitamin E, just some micronutrients that in countries that have a lot of undernutrition, especially in kids, that would just aid in their healthy development. Like he talked about stunting's a problem. I saw a lot of, does anyone know protein energy malnutrition? What's one of the most common signs of it? Yeah.
The stomach is distended.
Yes, so that's the edema because the proteins are involved in kind of fluid regulation, and so a lot of kids I would see would have really big stomachs. Obviously, they're not overweight. They're still very skinny elsewhere, so you can get either wasting, which they're just completely kind of skin and bones, or you can get kids with the big stomach. A lot of the food there was very starchy. It was very filling, but didn't have a lot of micronutrients, and that's kind of where adding moringa would come in. Culturally, I know when I was cooking with one of the mamas, I wanted to add in lots of vegetables into something, and she was like, "Ooh, no, like I don't want those," because she didn't like them. But they have vegetables there, and they have lots of fresh fruit and vegetables. Like when you go to the market, it was just, if you like fruits and vegetables, you could get stuff for so cheap. Mangoes were like 30 cents or less, and but it's the whole culture. That's not what. Maybe that's not even affordable to them. It seems cheap to us, but it might not be affordable. It doesn't fill them up as much as ugali, which is kind of like it's cassava flour and water, and it's just kind of a big thing of food starch that they can eat. It really comes down to what's going to fill them up sometimes. And as a food nutrition student, I'm like, eat your vegetables. Not actually, but I think sometimes they gotta do what they gotta do, fill up their kids. And it's just finding smart solutions to kind of infusing those nutrients into foods that they're going to be eating. Does anyone else have any last question? Yeah.
This is a question about how to measure the impact of your project. So I just wondering what are some of the ways you would use to
Whenever an intern comes back, they do a debrief. So then we kind of get an overview of what's going on in the community, what's going well, what's not. Actual impact on the community, we've done a lot of kind of testimonial side of things. I think that there could be more done. I think someone coming in more objectively, because I don't know, I found that a lot of the time they would tell you things that they think you want to hear. So if someone came in from the outside, objectively to talk to these people, I don't know if they would tell you anything different. Maybe they would if they didn't feel, because I think they like the product and they want it to stay, so they want us to know that it's benefiting them. But yeah, I think there could be more done with the actual impact of the product on their health. There are a lot of testimonials out there, but I mean, testimonials only go so far. I don't know how you would actually, do more. I guess the numbers of people that they're serving, we kind of like the day-to-day business. You would see how many people are coming into the kitchen. If the mamas are going out, how many people they're feeding, how many liters of yogurt they go through a day, that kind of thing. But there's always more that can be done in that sense.
In the movie, the video you showed at the very beginning, the woman said, before I started this yogurt, my CD4 was this much, and I'm hoping later it will increase. Is that a measure of the increased immune system?
Yeah. I mean, Dr. Reed's done a lot of studies over there he's done studies on CD4 count and then bacterial vaginosis. HIV is transmitted. There's 3 things to transmit it. Someone has to have the virus in a high enough load for it to be transmitted. There has to be contact between fluids, and there has to be either semen or just like blood. And spit doesn't really transmit it. It's not high enough. The viral load's not high enough. So that wouldn't transmit it. But there has to be an opening. So if you have sores in your mouth, STIs is why it's transmitted a little more efficiently. So probiotics, they're thought to help increase the microflora in the vagina, so the STIs will hopefully heal, and so there won't be that opening. So there's been kind of studies done on that side of things. But yeah, the CD4 count is a good indicator if it's being beneficial or not, and there has been studies on that. I have them somewhere. If anyone's interested, I can maybe give that to one of the organizers. I think we're out of time, but thank you for having me. I hope you learned something.